As soon as you're pregnant, you'll get advices from your relatives, your friends, what to do and what not to do, what to eat, what not to eat, and how to behave. Again, once you have delivered, during lactation, again you will be given advices that you should not be eating certain kind of foods to avoid sour lactation. I'm Dr. Aruna Kalra, uh, Director Obstetrics and Gynae Department at Hospital. I've been practicing obstetrician and gynecologist for more than 25 years, and today I'm going to let's start with pregnancy. As soon as you are pregnant, people would start telling you that you should not be eating certain kind of food items, and first and foremost is pineapple and papaya. Pineapple and papaya have vitamin A, and every kind of fruits or other food items, cereals or pulses or vegetables have vitamins or minerals in it, which is definitely everything is good for our body. So we should not avoid any kind of fruit or food item. Yes, in moderation, everything is good. Sometimes you would be advised that dry fruit should not be taken, or a thing which has a warm seed should not be taken. Again, all these things only if you are allergic to any product, like if you to peanuts, if you have lactose intolerance, or if you are allergic to seafood, you should be avoiding that particular type of food, and not everybody should avoid everything, like non-veg should not be eaten or something like that. Another thing which people would tell you, that you should not climb stairs, or you should not sit, or you should not like sit on the floor, or you should not bend, or you should stop exercising. Again, all these things are wrong. If you have a normal pregnancy without any comorbidities and your obstetrician has not advised you to have rest, you can climb stairs, you can drive, you can sit on the floor or bend. Every kind of activity you can do. Only if obstetrician has advised you, you should be taking bed rest. You should be first trimester. People say that you should not exercise. If you are exercising before, which needs reflexes like badminton or other exercises, you should be avoiding that. But you can jog, you can walk, most of them. Like we have this commercialization of pregnancy nowadays, and many creams are available in the market which would guarantee you that you would not develop scar marks. But it does not depend upon cream or quality of cream. If you have good stretchability, apply anything or not, you would not develop any scar marks. But if your stretchability is not good, whatever you apply, you would develop those scar marks. Another myth during pregnancy is whether you should be using makeup or not, and that whether you should be going to parlor, whether you should be dyeing your hair, laser treatment, and everything. Again, less of chemicals would be better. If it is totally mandatory, go for ammonia-free dyes, or dyes, or items, cosmetic items which are which are not too much of chemical, mostly organic in nature. But it's not that you should start looking ugly and you cannot go to parlor for your needs. So that is again a myth. Another thing which is very common is that if there is eclipse, you should not eat something, or you should not sleep, or there are many restrictions during eclipse. Yes, we say that going out might harm anybody. For that matter, if you look at the eclipse, solar eclipse through naked eye, it is because those rays are stronger rays, and we would not want you to get harmed, whether you're pregnant or not. But maybe having some effects of those UV rays, no scientific research has till now proved it. And again, you not sleeping, not eating, or not drinking is completely not acceptable. So I think that is again a myth which we should not follow. People say that you should prepare your your nipples for breastfeeding before delivery. No, it is not required. As soon as you deliver, your breast would be ready for breastfeeding. So it is again not required. Another thing is, as soon as you're pregnant, you start feeling that you should gain weight. From first trimester onward, your concentration is to gain weight. If you're eating healthy, if you're pooping every day, if your diet is good and good vitamins, minerals, and calories, even if you do not gain, that is absolutely okay because for first 5 months, baby's weight is only 250 to 400 grams. For that, you do not need to gain extra weight. Sometimes in loss might be there, so you should not be worried. Your weight gain is not going to translate into baby's weight. Again, you should not be eating for two persons. So it's not that your diet should be double because baby's weight would be by term 2.5 to maximum 4. So for that you do not need to eat uh, double the diet. So this is again a myth which we should understand. Uh, Another very important thing is that you should lie down in one particular position, which is mostly left lateral position. No, left lateral position is not compulsory until unless your obstetrician has advised, until unless you have total dextrorotation, right side deviation of your uterus, and your baby is not getting enough blood supply your big artery, which is aorta, and supply to your baby might be restricted, but not every time. So, during night when you are not aware which side you are sleeping, that is absolutely okay. You should not feel guilty about it that you slept on your right or you were sleeping in supine when you got up. So you can sleep in any position. Exercise is very important during pregnancy. You should know that because if you are eating good amount of food and if it is not going towards your baby, it is waste. So if you have gained much but your baby is not gaining weight, it means that you are not directing that blood supply or that nutritious blood supply to your baby by doing pelvic exercises. So pelvic exercises are very important, and from second trimester onwards, like first trimester also you can do exercises, but from second trimester onwards, butterfly position, vajrasana, and squatting exercises you please start doing, and it will direct your blood supply to your baby's blood supply, and baby's weight would increase normally. Very important and a big myth here is that you cannot have sex during pregnancy, which is again a total myth and wrong. If your placenta is not low lying, you can have sex during pregnancy. First trimester we try to avoid, but after first trimester, you can have your regular normal love life. So it's not that you should avoid sex absolutely during pregnancy. So these were few points, few myths during pregnancy. You have delivered, first thing which people would start advising you is that your breast should be prepared for breast milk. Your nipples should be clean, those they are clogged and they should be prepared. And no, it's not required. You have a nice bath or sponging your breasts without doing all these rituals. And whether it will be enough, there would be enough breastfeeding or breast milk for my baby. So breast tell us that whether you are one bigger breast would be having better supply. So size of breast does not equate into milk production. Second thing, my nipples are baby should take that areola in baby suckles on that areola to extract the milk. Whether nipple is formed or not, or retract, this is the exact point. This is the exact point. Once baby suckles on the areola, only then baby would get breast milk, not on nipple. So it does not matter whether your size of your nipple is really big or very small or flat. You can breastfeed your baby without hesitation. There would not be any problem. Another thing is, if I have fever or if I'm on some kind of medication, can I breastfeed my baby? Yes, whether you have fever or whether you breastfeed your baby. In today's time, if you have COVID also, just wear mask, clean your breast with soap and water, your hands with soap and water, and breastfeed your baby. If you're on some medication, which you should discuss with your obstetrician and your doctor who has prescribed you that medicine, if it is for, if it is antidepressant, if it is for epilepsy or something else, we should be taking safer medicine, which can be safer for baby as well. So if you were taking some medicine um, during pregnancy for say epilepsy or depression or anxiety, it was safe for baby in utero, you can still continue those medication and continue breastfeeding. Another myth around is that you should not be eating some kind of, they take air reason for their gassy problems or colic problem, not because you have taken some kind of food and few items only. Please eat every kind of diet. Uh, Many other myths are there. Breastfeeding, like if I have not started breastfeeding in first few weeks, I might not be able to breastfeed my baby. How much feeding in first few weeks, I might not be able to breastfeed my baby. How much formula feed or feed from what baby develop breastfeeding routine first. Breastfeeding is difficult, then bottle feeding. So if baby is able to latch on breast and extract milk efficiently and for initial 2 to 3 bottle once a day, but not more than that. And we are introducing bottle if you have to wean the baby and if you have to start working immediately after that. Katori chammach would always be preferred, but if you want to introduce bottle, let baby learn breastfeeding properly and only then introduce bottle. There should not be any confusion in babies. Introduce bottle, let baby learn breastfeeding properly and only then introduce bottle. There should not be any confusion in a baby's mind. Another where I can express, like once I have started weaning, I have to suddenly stop breast feeding, otherwise I'll develop lumpy breast or there would be breast abscess. Before going to your work, your breast would not produce after few days. During the day, the breast milk, there would be enough breast milk in the morning, and again once you come back at night, there would be enough breast milk. But during the day, breasts, they start becoming soft every consecutive day, and there would not be enough or much breast milk to give you discomfort or breast abscess. Is that people around you would tell that breastfeeding should be every 2 hours, or it should be uh, there should be a rhythm to it, and you should not be with baby all the stamina to suckle latch to extract the milk. And because when newborn is really small, as soon as baby is on your tummy with your breast, baby feels secure, and baby forgets to breastfeed. Baby sleeps there. So if your child wait again suckles, so if do not show restlessness, you should be very patient with baby. Forgets that she was breastfeeding. and because baby's tired and they sleep then and there. And once that okay, you have already breast, so I'm putting your child would be awake and start thinking, okay, I was breastfeeding and where is the breast now? So initial for 2 or 3 weeks, you would be needing actually 24 hours routine, but eventually once baby gains weight, develops stamina, you can have demand feeding. If your child is sleeping for 4 hours, is okay. So a baby would develop its routine, but it would take 3 weeks time post delivery. So do not be hesitant to peeing, passing urine, milk, and it is not that your breast milk is not enough, and that is why baby is crying or that is why baby is not sleeping. If because we give them as for pooping quite often, we ask them to please take in moderation, but it can be taken, and there is no reason we should as Bhavna as us. So there is no need. Durga is asking.